Hi, everybody. Welcome to Healthline. I am Gregory Zarian, and the conversation today is all about affairs of the heart. How healthy is your heart? I'm going to give you some statistics that hopefully will change the way you take care of your ticker. Okay. Did you know that every 33 seconds someone dies from cardiovascular disease? Did you know that cancer and AIDS combined are beaten by deaths from cardiovascular disease? Did you know that a heart attack happens every 10 minutes? And did you know that over 150 people die every day? So what are you doing about you and your heart health? I decided to take a little field trip and come to the Heart and Vascular Institute at Glendale Adventist Medical Center. Glendale Adventist Medical Center is a STEMI receiving center. It is top performing in its field. So joining me is John Dale, cardiovascular clinician. And next to John is Gina Shepard, the chest pain coordinator here at Glendale Adventist. Thank you so much for being with me, Gina and John. You heard the statistics. First of all, John, this is your field. What do you think about the statistics?
They are pretty staggering. I don't think the general public is aware of numbers like that.
It's every 33 seconds, and collectively, cardiovascular disease outruns AIDS and all types of cancer together.
Right.
Gina, what does it make you think?
I feel that people really need to be aware of their cardiac health and take care of their heart and their health, diet and exercise, and just be aware of what happens with the heart.
And when you said diet and health, later on in the program, we're going to be joined by Dr. Joe Bornheimer, and he's going to share with us different types of cardiovascular diseases.
Right.
Okay, so at the top, I said STEMI, receiving, top performing. What does STEMI mean, first of all, John?
STEMI is a classification of a heart attack.
Okay.
In fact, it's the most serious, dangerous type of heart attack that there is. It means a large amount of heart is in jeopardy because there's a blockage in the artery supplying blood and oxygen to the heart. When that's blocked, and if it's not resolved in a timely manner, you're going to get irreversible heart damage.
And that goes along with what you do, Gina. It's pain.
Yes, it starts with chest pain, chest pressure. If you experience any of those signs and symptoms, or if you know anyone that experiences the signs and symptoms, you need to call 911 and get to the nearest emergency department.
John, you said most serious and dangerous. Gina, when we hear that, what are we looking at pain-wise?
Chest pain, chest pressure, and women have different signs that you need to be aware of those too.
Right.
And that if you feel fatigued, or if you have the jaw pain and the neck pain, then you need to call 911 immediately and get to the emergency department.
And you also, one thing that people don't pay attention to is they may be suffering from a heart attack or suffering from a stroke. Because what is it? For heart attacks, time loss is tissue loss, or
Time is
loss
tissue.
Time is muscle.
Time is muscle, and with strokes, time loss is brain loss. What you need to do is know exactly what hospital you need to go to for every specific malady or ailment or anything you're suffering from. And one thing too is in your wallet and in your purse, before you are rushed to emergency, have a list of medications and history of your family health, because sometimes you may be flat on the table, unconscious, and no one knows what's going on with you. Right?
True.
It's very important to have that, especially if you have any allergies to medications. It's very important for us to know that so we can provide the proper care in a timely manner.
So make sure that you have all the medication you are taking in your wallet, in your purse, and family history. When we come back, John and Gina are going to share with us more about what we need to know about chest pain, what it means to be a top-performing receiving center, and a few helpful hints as to how to keep your ticker healthy. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and the conversation is all about affairs of the heart. Joining me still are John Dale, cardiovascular clinician, and Gina Shepard. John, we talked about what STEMI means.
Right.
Top performing receiving center. What is that?
Well, on a recent audit, we get re-audited every 3 years to be maintain our credential as a STEMI receiving center. And we were told at that point that we were one of the top performers in the area. That means that we're getting our patients in a timely manner up to the cath lab, and having their arteries reopened, or what we call dilation, within the goal of 90 minutes from the time the heart attack was identified out in the field. We have an average time currently of 72 minutes from the field to our dilation in the cath lab, and we meet that 90 minutes or less 92% of the time.
Gina, what does that mean? John just said 72 minutes, 90 minutes. What specifically is that?
That means that from the time that the patient walks in the emergency room and gets an EKG within 10 minutes. The EKG is basically a snapshot of the heart, if you will, to see what is going on, what the heart is doing, and it alerts us whether the patient is having a heart attack or not. Then we activate our process. We have a code. We activate it, and then we start counting the times that the patient moves on through the process from the emergency department to the cath lab, and as John described, to open up the vessels of the heart.
Okay, so as with stroke, time loss is brain loss. Heart is time loss is tissue loss.
That's true.
So is there any specific type of pain that someone suffers that they should pay attention to, or is it just, you know what, I think I'm having a heart attack, I need to go to the hospital?
Even something, jaw pain, for example, it's often a presenting sign, and people think maybe they have a toothache or something like that. They don't seek help because they're thinking it's nothing. And as you mentioned, acid reflux in the stomach, it mimics a heart attack quite a bit. So, you know, oftentimes people will avoid treatment thinking, oh, it'll go away.
And what are atypical signs and symptoms?
Not your typical signs and symptoms of chest pain and chest pressure. It could be acid reflux, so you may be confused with having abdominal pain or discomfort. It can be jaw pain for women, fatigue, for example. If you feel fatigued and tired, don't confuse that for just being tired of a hard day's work. It could be that you are having a heart attack.
So you need to really, really pay attention to it. And here's the thing, too, that I want to throw out there, too. If you do suffer from acid reflux or stomach pain or chronic pain, if you go to your doctor and have a checkup and a physical, you can then make the distinction as to what is what. Now, right behind us are beautiful hearts. And what happens here at Glendale Adventist Medical Center is if you are suffering from a severe heart attack, you'll have a procedure done in the cath lab. So I'm going to take John and Gina, and we're going to do a little field trip and go to the cath lab. I have an idea. Between now and when we come back, why don't you get up, stretch, have a glass of water. If you're smoking a cigarette, put it down. If you're having a cocktail, maybe replace it with something healthy. And as soon as you're done watching Healthline today, get up and take a walk. Because what you need to do is get your heart in shape. Don't go away. More when we come back. Shall we, kids? Let's go. So here we are in the cath lab. Gina and John, what happens in there?
This is where it all happens. This is where the patients come in and get treated for their heart attack.
Okay.
This is where the physician's going to come in and treat the patient and unblock the artery.
And this is where all of that happens.
Yes.
So if somebody needs a STEMI procedure, it happens all in there.
They'll do the angiogram and dilate the vessel if need be.
And bottom line, each case, each patient is different. What is recovery time after somebody that has a STEMI procedure?
It can depend anywhere from 2 days to a week. It just depends how severe.
Usually a couple days in the hospital and then recovery at home for a week.
Final thoughts to anybody that has to go through something that happens in the cath lab. What are your final thoughts, Gina, in regards to a patient or someone that has to deal with that?
Just be confident that things will go well,
Because
and
most
with a
people
lot
get
of
scared.
support, from the family and loved ones.
John?
Yeah, just be confident that highly trained staff, doctors, techs, everybody. You're in good hands.
Thank you so much for your time. Thank you so much for your time. When we come back, we're going to meet Dr. Joe Bornheimer, and he's going to share with you how to keep your heart healthy. Don't go away. Welcome back to Healthline. We just spent some great time with Gina Shepard, chest pain coordinator, and John Dayal, cardiovascular clinician at Glendale Adventist Medical Center. And the conversation today is all about affairs of the heart. So I decided to bring you Dr. Joe Bornheimer, interventional cardiologist, and he's going to share with us what we need to know about our hearts. How are you, doctor?
I'm good. How are you doing?
I'm fantastic. Interventional cardiologist. What does that mean?
Well, there are several types of cardiologist specialties. One is a general cardiologist, and there's invasive cardiologist who do angiograms plus general cardiology, and interventional cardiologist does angioplasty and stenting, and maybe pacemakers and other procedures for structural heart disease, which is going to be the coming thing in the new horizons for cardiology.
So what does that mean, structural heart disease?
It's primarily disease of the valves, the
Okay.
aortic valve, the mitral valve, tricuspid valve, and also some of the structures such as communications between the right and left side of the heart.
Doctor, how strong is our heart? How sensitive is our heart? And do we just take our heart for granted?
I think we take our heart for granted, but it is a very strong structure. You can't find anything that'll beat several million or billion times in your lifetime and make that out of artificial material like we do with our automobiles and things like that. So it's a very resilient structure.
So when we think of the heart, we know it beats 1,000,000 times in our lifetime. We know it's always on. What is heart disease? Because people hear about it. I don't necessarily know if a lot of people pay attention to it. What is heart disease, doctor?
Well, heart disease is a very generic term for a lot of different diseases of the heart. The most common things that people may have are elevated cholesterol, which leads to coronary artery disease, and hypertension. Many people have different types of heart arrhythmias, such as atrial fibrillation or supraventricular tachycardia, and all these are types of heart disease. But I think most of the focus for this conversation is going to be related to atherosclerosis and coronary artery disease and heart attacks and those kinds of things.
We were talking with Gina and John. What is a heart attack? Because we were spending a great conversation talking about Glendale, Venice being the STEMI Receiving Center, top performers. What is a heart attack?
A heart attack is a situation that occurs when one or more of the arteries supplying blood to the heart muscle becomes totally blocked. And the way that happens is that there's a plaque inside the artery which has a lining on it, and that lining eventually ruptures and tears, exposing the contents to the blood. The blood doesn't like that, and so it begins to clot over that area to heal it, but in doing that, it ends up blocking the entire artery with a blood clot, so no blood flow gets down to the heart muscle, and that's the heart attack. And that's when people begin having pain and shortness of breath and sweatiness. And if we can get in and get that area open quickly, then people can get by with almost not noticing or knowing they even had anything like
Even
that.
without their life fully changing at all.
Right.
You said valves. How many valves are there that go into the heart?
Well, with valves, that's a different thing. Those are like one-way doors between different chambers of the heart, and there are 4 valves. 2 on the left side, the aortic and the mitral, and 2 on the right side, the tricuspid and the pulmonary valve.
Can someone survive without one of those valves working, or 2, or we need all 4?
Well, you need all 4, but people do survive as they become more and more diseased. The more common valve problems are the mitral valve if it gets leaky, and the aortic valve if it gets leaky or stiff. And right now, those people go to operation to have the valve replaced or repaired, particularly in the mitral valve. But we're looking at situations now where we can repair those by catheter-based techniques.
Heart disease, is it hereditary?
It is. But it can also occur if you don't have hereditary genes. So if you pick the right parents, you can often do whatever you want. But if you don't pick the right parents, you have a problem with what the genes that you get, along with the other things that contribute to that, which is the cholesterol and high blood pressure, obesity, diabetes, lack of exercise, and those things, which are various risk factors for heart disease. Not to we forget smoking either.
Well, smoking. I was a smoker for 20 years, so I put down the cigarette, people. In regards to obesity, we are considered probably one of the most obese countries in the world, over 70%, and also with gaming and computers and all this social media stuff. Have you seen a rise in heart health declining because of how stagnant we've become?
Well, I think we are seeing a lot more people who are obese. I think part of the issue for those obese patients is they may not have reached the age when the effects of that is going to lead to heart problems. But now is the time for them to change if they can get it through their head that they need to change.
So where do you find heart problems starting? Is there an average age? Do you see it more so in men and women? Where do you see it shifting? Like somebody's living a healthy life and then all of a sudden there's a bit of a plateau, and in comes heart health?
Well, there's two aspects to that. One, if they are not living a healthy life, that tends to occur about 10 years later in women than in men. And for the men, it's going to be about in their 40s to 50s, and women's 50s to 60. If they're leading a healthy life, then it becomes a little bit later, maybe in the late 60s into 70s. And all the things that you can do, unfortunately, reduce the risk factors. It's unfortunate that we can't make the risk of heart attacks go away completely. We can certainly minimize them. And that's the things that we try and do.
When you say minimize them, what does that mean, doctor?
Well, by lowering the cholesterol and not smoking, having the proper weight, exercising, we can significantly reduce the risk of a heart attack. And certainly, I think, particularly with the use of the statin medications for lowering cholesterol, we've seen a marked reduction in the occurrence of cardiac mortality over the last 20 years since those have been introduced.
You said a few times cholesterol. What exactly is cholesterol?
Cholesterol is a fatty substance that is necessary for the cell, the lining and the walls of the cells of your body, so you need that. We get cholesterol by diet and by the liver, which makes cholesterol. And if you eat too much or your liver seems to make too much, then it can accumulate in places which are not good, particularly in the blood vessels, not only in the heart, but also in the legs, in the kidney arteries, in the carotid arteries in the neck, and in the brain arteries. And they can lead to various syndromes that occur relative to the organ where the blockage is. So you can have, for instance, a blocked artery in the heart is a heart attack, but in the brain it's a brain attack. Same kind of thing happens.
And bottom line is you don't want any type of attack.
You don't want any of that stuff.
Because as we talked earlier, time loss, with the heart attack, time loss is muscle loss or
Exactly.
tissue loss. And as I've learned for a stroke, time loss is brain loss. More with Dr. Bornheimer when we come back, and we're going to share with you some healthy tips on how to keep your ticker ticking in a healthy way. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and the conversation today has all been about heart health. Joining me is interventional cardiologist Dr. Joe Bornheimer from Glendale Adventist Medical Center, and we were talking about cholesterol and types of procedures. Doctor, before I go into the procedures and more STEMI procedures, what is an easy way to, I don't even know if it's easy, but what's a healthy way to keep your cholesterol down? If there's so many heart issues with high cholesterol.
I think it's paying attention to your diet, which means trying to eat foods that are not high in cholesterol and not high in saturated fats or trans fatty
What are
acids.
foods full of high cholesterol and trans fats, doctor?
Well, those are going to the McDonald's and those kind of foods. A lot of
McDonald's, Burger King, Carl's Jr., Jack in the Box,
Pizza.
number 4.
pizza, those kind of things. And so you want to, I think, concentrate more on vegetables, legumes, and protein, fish, chicken, turkey without the skin, and those kind of things.
And more of a colorful plate.
Exactly. Drink. I mean, the coming thing now is more people are cognizant of the benefit of kale and watercress.
I love my kale.
And also the other colored vegetables and fruits. So I think that's important for the future.
And also smoking elevates your cholesterol along with drinking as well.
It does, and particularly what it does is it lowers your good cholesterol, the HDL, which we think also is protective if it's high. And so you want to, if you're smoking, stop smoking. I know it's tough, but it's the best thing you can do.
I did it. Cold turkey.
And it's not only because it relates to your heart, but also there's an issue of chronic lung disease in the future if you've smoked for very long, and lung cancer. So 3 issues that you want to minimize in the chances for in your life.
And bottom line from smoking and lung cancer and having high cholesterol is, let's be clear, is people can die. And people don't even go to that. They're like, oh, I'll stop, but it's time to stop. Earlier in the show, I was talking to John Dale and Gina about the STEMI Receiving Center at Glendale. And it's when you are having a heart attack and you have 90 minutes to really get it covered. What are the treatment options for people that are suffering, who have to have STEMI? What are those treatment options?
Well, there are really 3 approaches if you come in with a heart attack. The best is to have an angioplasty, an angiogram, and a stent placed in there to open the artery.
Is that an angioplasty?
Yeah.
Okay.
Yeah, and the second best thing is if for some reason you're not able to do that, or that you're at a hospital where they don't have a cath lab, would be to give these so-called clot buster medications, which they give for stroke now. Then occasionally we have people who are not candidates for either of those procedures for various things, and we just treat them with medicine. And with those, we're not really treating the heart attack, but the complications that occur after the heart attack as it runs its course.
And bottom line is, if somebody does have a heart attack, they need to, of course, go to the hospital, go to the doctors. And do you find that most patients feel that, okay, I've gone through the process, I had a stint or something done, and I can be okay? Do a lot of people forget that they have to really make choices in their diet and their health and all that?
There's two aspects to that. People, I think, come in with a lot of trepidation, and many people will go home in a day or two and be back to work in 3 or 4 days. The interesting thing is, during the first 6 months after their heart attack, they are really gung-ho about changing their life and all that
Sure.
sort of thing, and then they forget about it when they've been feeling normal for 6 months or a year, and then it's tougher for them to continue with that. So it's a lifelong process of changing your mind and your habits after the first year, 6 months to a year after your heart attack has happened.
Because it takes a couple weeks to start a habit. So along with this STEMI procedure, what are other heart procedures that occur at Glendale Adventist?
Well, we're beginning to do procedures for blocked arteries that have been blocked for a long time,
Okay.
and that's taking some special equipment. Those are called chronic total occlusions. We're beginning the process for a percutaneous aortic valve program. The aortic valve, if it gets stiff, is treated primarily by operation, where you remove the valve and place a mechanical or a tissue valve in there. For people who are prohibitively high risk for that procedure, what we have been doing and what has been studied is a percutaneous approach, where we place a valve inside that valve and open it up like we have a stent in the coronary artery, but it's a aortic valve. And those people actually have done very well.
That's fantastic.
And so we're going to be beginning that in the next few months here, we hope.
And during the break, you brought up a procedure called the TAVR procedure?
That's the,
Is
yeah,
that the-
that's
is
the
that the name of
TAVR,
it?
T-A-V-A-R, yeah.
TAVAR.
Apical valve replacement.
Doctor, when people experience chest pain, what is your out and running solution to them?
Well, I think you have to question, if they're by themselves, it's one thing, but if they're talking to you, then you have to question them about different components of it. What is it like? When does it occur? How long does it last? When does it go away?
How long does it
What
last? If
factors
somebody's having,
it's different for everybody.
because I know for men and women it's different.
And for women, but not, and that's the issue. Not everybody reads the book to know exactly how they're supposed to have a heart attack. You have what you have. And so, and particularly for women and for some men too, you can have chest discomfort or pain from the belly button to the jaw. I've seen people with heart attack. For women, it may be more fatigue, sometimes nausea, sweating, shortness of breath, and those kind of things. But there are plenty of women who have the typical chest pain. It's just you have to have a little wider spectrum of suspicion in some women when they don't come in with the classic symptoms.
So could somebody just have a bit of chest pain once and then boom, it's done? I mean, what should somebody be looking for? Constant chest pain, or could one time be enough?
One time can be enough, and you can have, and we've talked about STEMI, but you can also have what we call non-STEMI.
Okay.
And that's a situation where we have the plaque that ruptures, the blood clot forms, and then it breaks up. And so your chest pain goes away, but you may have had it blocked long enough to cause some heart damage. And we do recommend that in those patients that certainly within the first 48 hours that we get to a cath lab and have an angiogram and see if you need a stent or bypass surgery.
Quickly, doctor, are there any supplements that you suggest for healthy heart health?
Not really supplements, I think just the
Like,
standard things.
but people hear about fish oil and
Well, the fish
other-
oil is fine.
fish oil,
Yeah, I
okay.
think I consider that as not as a supplement, but as a regular part of the treatment for triglycerides in particular. Yeah,
And final thoughts for heart health, doctor?
just try to minimize your risk factors. Keep your weight down. Don't smoke. Keep as active as you can, and enjoy your life. Laugh and have fun. It seems
People
to make a
don't laugh
difference.
enough, do they?
They don't.
Doctor, it's an absolute pleasure. So you
Thank
heard
you.
it from Dr. Bornheimer, and you also heard it from John and Gina early. Get your health on. Get up, get active, work out, laugh, play with your family, eat a colorful plate. We always think that somebody can do it for us, and bottom line is we're the captain of our own healthy ship. Remember, the most important conversation you are going to have is about your health, so why not have one right now? For more information on heart disease, STEMI health, and how to find Dr. Joe Bornheimer, visit glendaleadventist.com. We will see you again. Have a great night, and talk to you soon. Get your health on.